Hi team, everyone joined right? 1, 2, 3, 4, 5, 6. Okay. One second, I will share my screen. Yeah, okay. Today we are going to discuss about the Mohs surgery. Mohs micrographic surgery. So when patient have any Mohs defect, that means any cancer cell, basal cell carcinoma, squamous cell carcinoma. So this and all patient having that time they perform the most micrographic surgery. So in this, initially we need some physician and pathologist coordination, particularly in this procedure. Why? Because surgeon removed layer of the tumor only. So initially they perform layer of the tumor only they will remove and is sent to the path. So after pathologist will divide the blacks, number of the blacks. He examined under the microscopic. He examined under the microscopic. After that, he sent a report to the physician whether is there any normal tumor or is there any carcinoma or benign condition. He only sent to report to the physician. After that, is there any positive cancer cell means physician will perform the second stage, that means second layer of the tumor he will excised. Initially they perform upper part only, that means superficial layer only. After that they will excise some more deeper layer. Again he sent to the path. Is there still carcinoma cells is there na? Third time also he examined and he is excised to the cyst. Up to there is no cancer cells. That means pathologist will confirm there is no cancer cell until physician will perform the excision so continuously. So that purpose here mainly involved into the physician and pathologist, both involvement is there. So this is the first thing. Second thing, when most micrographic surgery they perform, now we have to cross check what type of the stage and how many stages they performed. For example, initial visit, first time patient came to the hospital, so that time they perform the initial stage, first stage. After that, in the stage, how many blacks he divided, number of the blacks. This is the second thing. So based on the stages, based on the blacks only, our CPT will be changed. So is some in the same operative report, they perform two stages. That time we have to cross check the number of the blacks, whether they perform 5, 6, 7. So we have to cross check. So this is the technique. Up to there is no cancer cell, up to physician will perform the this procedure, excision procedure. So particularly this defect involved into the face and hands, sometimes involved into the leg also. most defect involved into the mainly face and hands and legs. So after how many stages and blacks, after we have to cross check what is the exact location, whether it's a face or hands or legs. So this and all we have to cross check, particularly in the most defect. See, in this total 5 CPTs is there. Most micrographic surgical technique. So just click on the first one. Read the description. This technique, including removal of all gross tumor, surgical excision of the tissue specimen, mapping, color coding of the specimen, microscopic examination of the specimen by the surgeon, and histopathological preparation, including routine stains. So after that, we have to cross check the location, whether which location they perform this surgery. So we have to cross check head, neck, hand, feet, genitalia, or any other location. We will take this CPT when we have to consider na. So first stage, when physician perform first stage up to 5 tissue blacks. First stage up to 5 tissue blacks they perform is we have to append this CPT. In case this is the basic one. Next, another concept, if our document supporting for the additional stage, so we have to build add-on. So this is for the base code 17311. Is there any additional is there means we have to build add-on separately 17312. So particularly the location, head, neck, hands, feet, genitalia, or any other location. And sometimes they perform particularly into the trunk, arms, legs. Particularly trunks, arms, legs means we will go with the 17313 CPT. Is there any additional stages means we will go with the 17314. So next thing 17315, for example, stage 1 only, that means single stage only they will perform, but number of the tissue blacks 6. So that time our document supporting up to 5 tissue blacks only. So this is for the up to 5 tissue blacks. So additional 1 more tissue blacks also there. So that time particularly tissue blacks only they will perform additionally means we will go with the 17315 add-on. Why? Because this is particularly tissue blacks add-on only. In case they are append the any add-ons for this stage means in that stage CPT it's covered the up to 5 tissue blacks. More than this is there means we will bill for the 17315 each additional, not each additional black after 5 tissue blacks, each additional. See this one, each additional black after first 5 tissue blacks. We have to build this CPT. Are you getting my point right? What I'm saying?
Yes.
Yeah. If they perform the first stage, it's covered to the 5 tissue blacks. If physician perform additional tissue blacks means we have to append add-on only for the tissue black. Is there additional stage means we will go with the additional stage CPT. Additional stage add-ons. Okay,
Okay.
now I will give some examples. So physician perform not single stage, 3 stages. He perform the 3 stages. In the first stage, he perform the 5 tissue blocks. And second stage, 4 blocks. Third stage, like 7 blocks. So here, how many stages? 3 stages. So initial stage with CPT 1731. Each additional stage 17312. So here 17311 for the first stage, followed by 17312 additional stage, second stage, followed by one more stage also there. Third stage also they perform. So 17312. So here in the initial stage 17311, 5 tissue blocks covered. In the second stage 17312, here also up to 5 tissue blocks. That means up to 5 tissue blocks. So 4 only they performed. So that one also it's covered. Again, third stage. In third stage, it's covered to the 5 tissue, up to 5 tissue blocks only. So remaining 2 tissue blocks is there. Remaining 2 blocks additionally we have to build. So what is the CPT for tissue blocks? Yeah, done. So here 17315. Each additional. So total remaining 2. So we have to go with 17315 and 17315. So like that we have to append CPTs. Okay, are you getting right what I'm saying?
Yes.
Yeah, any doubts in this?
No.
Yeah. Okay, so this is the confirm the surgeon and pathologist are the same. When pathologist confirm patient having a basal cell carcinoma or squamous cell carcinoma, after that physician perform the additional stage and additional procedure. When physician confirm there is no cancer means pathologist will confirm that there is no cancer. So that time physician will stop that procedure. Second thing, identify the location where it's the exact location and site, whether it's a face, hands, or legs. Next, third thing, how many stages they performed. Fourth thing, how many blocks they are performed. So this all we have to cross check in the Mohs micrographic surgery. This is the thing. Next, breast procedures. So in the breast procedures, first beginning stage. In the beginning, any something someone noticed like any abnormal tissue or abnormal growth is there. So they don't know whether it's a normal tumor or any cancerous tumor. So that time patient went for the hospital. So that time physician collect the some of the specimen. That means initially they perform the biopsy only for the identification whether it's a benign tumor or carcinoma or any uncertain tumors. For that purpose, he will collect the specimen into the breast. So this biopsies mainly involved into the different techniques. What type of the techniques they are using, whether they are using with the percutaneous approach or open approach, let's say incisional biopsy or excisional biopsy. Sometimes they are using with image guidance, without image guidance. This all we have to cross check in the our procedure description. Okay, in this first one, percutaneous image guided breast biopsies. Percutaneous image guided breast biopsies. So in this, they will perform the 190, 81, 82, 83 this and all. Once I will open that CPTs. See, observe here. Biopsy of the breast with placement of breast localization. With placement of breast localization device such as clips and metallic pellets when performed, and imaging of biopsy specimen when performed. Percutaneous first lesion including stereotatic guidance. Initially they perform the biopsy, so that time they are using any localization device, for example clips and metallic pellets, this and all they are using. So we can consider breast localization device they are using. So after that we have to cross check how many lesions is there. This is the first lesion or additional lesion is there. Third thing, with image guidance, without image guidance. In case with image guidance means what type of the image guidance, whether it's a ultrasound guidance, MRI or mammographic or stereotatic. So this and all we have to cross check. Why? Because 19081 supporting for the stereotatic guidance. Each additional lesion means we have to build 19082 add on. Each additional we have to build add on. Same localization device technique only. Now they are using the ultrasound image. Previously stereotatic image guidance, now they are using the ultrasound guidance. So that time we will go with the 19083 for the first lesion. Is there any additional lesion means we will go with the 19084. So this is the second thing. Same like this, different image guidance. MRI image guidance 19085. This is for the MRI image guidance. So we will append 19085. Is there any additional lesion means we will go with the 19086. So this is the all percutaneous image guidance, different images. So in this they are using image guidance. So 7 series no need to build separately, particularly in the breast biopsy image guidance, localization image guidance. So some of the procedures they want 7 series also, but in this procedure, in this biopsy techniques, no need to build separately 7 series. So here also they are showing same thing, 76098 and 76942 77002 77021 may not be separately reported for the same lesion when more than one percutaneous breast biopsy with or without localization device placement performed using the same image guidance. Modality means image guidance. Type of the image guidance used an add-on whenever additional service is on the same or contralateral breast. So that means right side they perform the ultrasound image guidance. Left side they are using the some MRI image guidance. So that time we have to cross check the edits. Why? Because it's showing edits. So that time we have to append 59 modifier. If not showing any edit means no need to worry. Why? Because sometimes it's showing the edit. So we have to bill. Why? For the 59 have a separate concept, whether it's a separate incision or separate procedure or separate structure. So this is the eligible criteria for the 59. So we have to append 59. Why? Because this is the another side. So contralateral side. So that time we will add 59 and we have to build together. Next thing, if additional percutaneous biopsies with or without localization device placements are performed using the different imaging modalities, report primary code each additional biopsy with or without localization device placement performed using the different image guidance modality. Here they are showing additional percutaneous biopsies they perform that time, whether they are using any localization device or without localization device, they are using the different image guidance. Report another primary code for the each additional biopsy. That means we have to build two CPTs together. So that is the concept here. Are you getting right what I'm saying? If it's showing edit also, we have to build. Why? Because that is the different structure. So that is the concept. Next, open incisional breast biopsy. What is the meaning of incisional biopsy? What is the difference between incisional and excisional biopsy? Am I audible right? No one don't know, huh?
In incisional biopsy, normal incision is performed.
It is a simple cut within the skin, and excision means total removal of dead tissues.
Yeah. Normally, incisional biopsy, excisional biopsy difference. Incisional means in the entire tumor, they will collect some of the part. That means they will collect some of the specimen only. But excisional biopsy, they will completely excise the tumor. So that is the difference. When they will collect the sum of the specimen or entirely they removed. In the header also they mentioned incisional biopsy, but our description supporting for the excision. Just a simple one line they mentioned this cyst was removed entirely. So that time we have to go with the excision CPT, not for the incisional biopsy. So this and all we have to cross check when they are mentioned in the header also, but we have to bill excisional only. See next 19100. So this is biopsy of the breast, percutaneous needle. What type of the needle? Core needle. Not using image guidance. When they are perform the core needle biopsy without image guidance. So that time we will go with the 19100. This is percutaneous only, but without image guidance. Directly we will go with the 19100. If they perform the open type without image guidance, biopsy of the breast, open, incisional. What is the difference between open or any image guidance? So what is the difference means? Open, direct eye visualization. So they will look directly and they perform. Physician will perform the procedure. When they are using image guidance, with the help of the image guidance, they perform the procedure. So that is the open, that is not the open procedure. They will using the some of the image guidance. So that is the thing. Sometimes they are using a scopy type instrumentation. So we have to cross check what is there any endoscopic or any image guidance is there or not. So open means direct eye visualization procedure. So that is the difference. When they perform the incisional biopsy openly, we will go with the 19101. Particularly in the breast procedures, we have to cross check the modifiers, laterality modifiers. Why? Because some of the payers not eligible laterality modifiers. Some of the payers they want to build laterality modifiers. We have to cross check our project guidelines also. So that is the thing. Just click on here. See this one. Under this notes is there, right? So for placement of percutaneous localization clip with image guidance, see 19281 just click on here. 19281.
Device placement code.
Sorry.
Need to build both, right? One in performing open biopsy, they will place any clips. Means we need to build both, right?
No. In the open biopsy, this one only. So see here. See this one. Open incisional biopsy 19101 does not include the image guidance. However, open incisional biopsy performed after image guided placement. After image guided placement. Localization device, the appropriate image guided localization device placement that codes 19281, 282 up to 288 may also reported. We have to cross check only one CPT, no need to append 19101, that one. So 19281, this is for the placement of breast localization device, clips, metallic pellets, wire, needle or radioactive seeds, percutaneous, first lesion, including mammographic guidance. For this, add on 19282. Same image guidance, mammographic image guidance, but each additional lesion means we have to build 19282 add on. At the same time, stereotatic image guidance means 19283 for the add on 19284. Same. This is for the ultrasound image guidance.
I have one doubt. The stereotatic.
Yeah.
Actually, in some sorts they have mentioned like they have done percutaneous biopsy under the guidance of stereotatic. They have used 2-dimensional image and converted to 3-dimensional. In that case, we have to go with this code, right?
No, 2-dimensional, 3-dimensional does not affecting the CPT.
Okay.
So any image guidance, same, this CPT only, does not affecting any one. So whether our documentation, whether our CPT supporting 2D separate and 3D separate means we will go with the separately. But here our CPT description does not mention anything about that information. So that is related to the radiology.
Okay.
Yeah. So based on the image guidance only, we have to build different CPTs. So particularly in the breast biopsies, we have to cross check the technique. Second thing, image guidance. Third thing, how many lesions. Based on that one only, number of CPTs will come. So we have to cross check everything. This biopsy techniques and all initial stage of the procedure. Initial stage of the procedure. So after this, if they perform the biopsy, so up to here, okay, they will identify some of the cancer cells. So what is the next thing? So that next step will be excision procedure. Now they identify some of the cancer cell. So they need to remove. So if they removed only that cyst or the tumor, how much is there? No? They remove that tumor only. They didn't remove any breast nearby structures. They removed that cyst entirely. So we have to go with the mastectomy procedures. Why? Because they will remove only lump or entire cyst or entire breast. What type of the technique they performed? Based on the condition severity, they perform the procedures. The tumor does not affecting the nearby structures means they will resect the tumor only. If the tumor nature will easy to spread the nearby structure means they will remove nearby structures entirely. That means total breast they removed. If that tumor involved into the part of the breast also, they removed entirely breast, not only breast, surrounding structures also they removed. Why? Because that cyst nature easy to spread the nearby locations. So that's why they will resect in the early stage. Our documentation, they have mentioned partial mastectomy or complete mastectomy. We have to cross check. If they perform the mastectomy, we have to cross check what is the technique they are using. Mastectomy. Under this, complete simple mastectomy. Complete. Observe here, complete mastectomy 19303. Same time, partial mastectomy they are showing 19301. For the complete mastectomy means they will remove entire breast. Partial mastectomy means they will remove the tumor only or part of the breast only they removed. So that is called a partial mastectomy. Complete mastectomy means they removed entirely. When they perform the partial mastectomy, along with they are remove any nearby structures, any lymph nodes, or with the help of the any placements, we have to cross check. Partial mastectomy with axillary lymphadenectomy means we will go with the 19302 CPT. See, observe here 19301. This is the mastectomy partial. That means lumpectomy, tylectomy, quadrantectomy, and segmentectomy. So lumpectomy, they removed that lump only. So we have to cross check our documentation description whether they removed part of the breast or entire breast or nearby structures, breast along with nearby structures they removed or not. We have to cross check all these things. Why? Because they perform the only lumpectomy or only quadrantectomy or only tilectomy, only segmentectomy means we have to consider it's a partial mastectomy. Along with this, they will remove the axillary lymph nodes also. We have to go with the 19302 CPT. If complete mastectomy is, they will remove. Yeah.
In this case, if they have removed axillary lymph node, now we can go with the 3 series, right? 38500, 38525. No, or inclusive with this itself.
Yeah. For the partial mastectomy, it's inclusive. Here only it's showing axillary lymphadenectomy.
Okay. No, I'm asking level 1, level 2, level 3. Like that, we want to check. In this axillary lymphadenectomy means complete axillary nodes have been removed.
So up to here, they mention any deeper structures or superficial structure, we have to cross check.
Okay.
If it's our document supporting to super or deep means we have to go with the additional.
Okay.
Yeah. Mastectomy partial. After that, mastectomy simple complete. 19303. So in this time, complete mastectomy means they removed breast entirely. So that is the thing. In this complete mastectomy, in this they will perform the nearby structures removal such as axillary lymph nodes and pectoral muscles. They remove now, we will call it a radical. In the term radical means they will remove nearby structures also. So that is the term meaning. Nearby structures also they removed. When they perform the radical mastectomy, they removed breast along with nearby structures, pectoral muscles and axillary lymph nodes. In the interview also they are asking what is the difference between mastectomy and radical mastectomy. We have to say like this: mastectomy two types, complete, partial. Complete means they will remove entire breast only. Partial mastectomy means they will remove part of the breast. Radical mastectomy, they will remove breast along with nearby structures entirely. Along with nearby structures entirely. Pectoral muscles or axillary lymph nodes, both they removed entirely. Next thing, urban type. So here axillary lymph nodes and internal mammary lymph nodes, both lymph nodes they removed in the radical urban type. Radical urban type. So that time we will go with the 19306 CPT. In the header they mentioned radical mastectomy also, but in the description they are given like internal mammary lymph nodes also they removed means we will go with the 19306 CPT, not 19305. Next, this is the radical mastectomy. Next, modified radical mastectomy. What is the difference between radical modified means in the radical they removed entirely. In the modified radical they will save some muscle, they will remove some muscle. So observe this CPT descriptions. Radical means they will remove entirely, but modified radical 19307 it's showing including axillary lymph nodes with or without pectoral minor muscle but excluding pectoral major muscle. For example, in this they will remove one muscle, they will save one muscle. That is the description. That is the modified radical. See the details. If you have any confusion, Just to go by the latum. See here, the modified radical mastectomy. In this procedure, there is a removal of the all breast tissue from the affected breast with axillary lymph node removal from the armpit on the affected side of the body. The surgeon perform the procedure using the elliptical incision that start on the inside of the breast near the breastbone and extended toward the armpit. Typically, it includes the removal of the both nipple and areola, but procedure can be performed using the skin and nipple sparing method. The pectoral minor muscle may or may not be eradicated, may or may not be pectoral minor muscle, but pectoral major muscle of the chest under the breast is spared. The skin or flap may be used at this time of the required. So here may or may not be removed pectoral minor muscle, but pectoral major muscle completely eradicated, completely removed. When radical mastectomy, they will remove entirely. But here they removed one muscle, they will save one another muscle. That is the thing. Modified radical. So these are the points. Mastectomy partial. What are the CPT is 19301 A portion of the epislateral breast tissue was removed, such as lumpectomy, tylectomy, quadrantectomy, segmentectomy. Next, mastectomy simple complete. Total removal of epislateral breast tissue with or without removal of the skin and nipples. Next, radical mastectomy. Total remove epislateral, bilateral, epislateral breast tissue, including nipples, pectoral muscles, axillary, and internally lymph nodes. So these are the mastectomy procedures. In this, any doubt?
Patient underground reconstruction following removal means how to code.
Yeah, wait 1 minute. I will tell. Sorry.
If patient undergone total skin sparing mastectomy or total nipple sparing mastectomy, and they have done reconstruction also.
Yeah.
In that case, we want to build this mastectomy 19304 code also.
Yeah, based on our edit.
Okay. Can you please show that edit also?
Yeah. So tell me that CPTs.
19304.
19304.
They have done any flap like 19361.
19361. 19304. It's wrong. There is no code.
What is 303 or 304? I don't know.
We are not showing any edit.
You can build both, right?
Yeah, we can build, but
Mm.
in the mastectomy and reconstruction, we will go together. Before we have to cross check same day reconstruction or delayed. So we have to cross check this and all. Why? Because in the same session they perform the mastectomy and reconstruction means we have to go with the another CPTs also there. If delayed treatment means have a separate CPT. So we have to cross check all the CPTs.
Okay. Yes, I'm getting your point.
Yeah. So next one, that one reconstruction only. So this is the radical. So that means biopsies they perform. After that they perform the excision also. So now they perform the reconstruction. Biopsy done, excision, tumor or breast something they removed. For example, mastectomy they perform, they will remove the entire breast. So they want to reconstruction the breast. So that time with the help of the, sometimes they are using temporary implants and sometimes they are using the permanent implants. So we have to cross check whether they are inserted temporary implants or permanent implants. We have to cross check. The slide was missed. Okay. So in the breast reconstruction, particularly what type of the technique they are using, whether they are using in the augmentation or in the mastectomy or nipple reconstruction or reduction or revision procedures. Why? Because augmentation, reduction, this all the cosmetic surgery. So there is the no any diseased condition. Normally based on the size or based on the shape, they perform the augmentation and reduction and mastopexy. Other than this is the related to the conditions. So now they perform the reconstruction with the help of the implants. With the help of the implants, sometimes they are using the acellular dermal matrix or tissue expanders. Initial stage, they are using the tissue expanders or acellular dermal matrix. With the help of this, they will expand the breast size. Or temporary implants they are using. After this, they removed this one. After this, they removed ADM, acellular dermal matrix means they removed ADM or tissue expander. They will implant permanent silicone implants inside the breast. Permanent silicone implants inside the breast. So these are the stages procedure. Initially they perform the mastectomy. Immediately they perform the reconstruction means have a separate CPT. Delayed mastectomy have a separate CPT. This is the based on the condition. Now they coming for the normal cosmetic purpose. That means augmentation or reduction. Augmentation means they want to increase the breast size. They want to increase the breast size. Reduction means they want to decrease the breast size. Next, mastopexy. So in the mastopexy, they will correct the shape. So this all the additional procedure of the breast. We have to cross check what type of the techniques they are using, whether they are using acellular dermal matrix or tissue expanders or silicone implants. We have to cross check. Initially they are placed, but is there any complication like any contraction or any rupture or any leakage or any painful? So that time they came back and they want to remove or they want to replace. So this all the staged procedure. In the initial, what is the technique they are using? After that, in the second stage, what is the technique they are using? So initial stage, they will implant some of the temporary implants. In the second stage, they are replacing with the permanent implants. We have to cross check. So this is the condition, mastopexy condition. So normal position, minor deviation. So next, moderate deviation, severe deviation. So like this condition is there means they will perform the mastectomy. So that time they will correct the shape and size by lifting the breast. They will collect the shape and size. So that is called the mastopexy. When breast size they want to increase means augmentation, decreases means reduction. So we have to cross check all these things. See, this is the capsular contracture. Once a breast implant is in place, fibrous scar or tissue forms around that, creating the tissue capsule. The body forms the protective capsule like around the object and it recognized as a foreign. So this tissue capsule is usually soft and slightly firm, not noticeable, and helps to keep the implants in the place. So when they perform the initially they are implanted some of the breast implants. So after that something that scar will form or some contraction will be there. So are any leakage or any irritation or any pain, so that time they perform the replacement. We have to cross check if capsular contraction is there means have a separate CPT. If they remove and replace with new one means have a separate CPT. So this all we have to cross check. Next thing, this is revision peri-implant capsule. So here they perform the revision. What is the difference between revision or replacement? No idea.
Revision is increase the size of the breast.
Okay, replacement. Okay. Normally, yeah, I will tell you. Revision means they will remove and they will replace same instrument. So they did not exchange. Same implant only they will place again. So that is called the revision. Replacement means previously they are implant one something some other implant. Now they will remove that one. They will replace with new implant, not same one. They will replace new one. So that is the replacement. When they placed the same old one means that is called the revision. So this all we have to cross check whether they perform the revision or initial placement. Sometimes replacement placement have a same CPT. We have to cross check all these things. In this revision of peri-implant capsule breast including capsulotomy, capsulorrhaphy and or partial capsulectomy. When they perform all this capsulectomy, capsulorrhaphy, partial capsulectomy, all inclusive in this revision procedure. So no need to bill separately. Here one more guideline they are mentioned. don't report 19370 in conjugation with 19328 for removal and replacement of the same implant access capsule. When they perform revision, so that time no need to bill 19328. What is the CPT of 19328? We'll check once. 19328. So this one, remove intact breast implant. So when they want to perform revision, compulsorily they need to remove that implant. So inclusive in this procedure, no need to bill separately. Don't report 19370 in conjugation with 19328 removal and replacement of same implant. So next, for removal and replace with new implant means we will go with 19342. When revision perform means 19370, replacement means 19342. See this one, insertion or replacement. Here they are given for the insertion or replacement same CPT only. Breast implant on the separate day from the mastectomy. See here, observe this one, separate day from the mastectomy. For example, in the same operative session, they perform the mastectomy and breast implant also. We will go with this CPT, not this. Separate day from the mastectomy, and one more CPT will be there. See 19340, insertion of breast implant on the same day of the mastectomy, immediately. Same day means we will go with 340, different day means we will go with the mastectomy. That is the thing. We have to cross check when they perform the mastectomy and what is the technique now. So this all we have to cross check. So okay, in this any doubt? No doubt. Okay, we will wind up today. I start another one. Okay, bye bye.
Okay, bye. Thank you.
Thank you.